Hi, how are you? Hope you're all good today. Today I'm just going to look at briefly the types of dressings that we come across daily in our wound care plans. So first type of dressing would be the likes of this hydrofiber. Okay, so we would have many that we'll be familiar with. You can put it to dry dressing and you put it on a wound that has moderate to high amount of exudate. Hydrofiber. Another type of dressing very similar to hydrofiber is alginate. Again, it's a dry dressing. You put it on a wet wound and it absorbs up any exudate. They both turn into a gel. Another type of dressing would be the likes of a non-adherent dressing. So we'd have just an island dressing here with some adhesive. We would have another type of one here as well. Then you'd have a non-adherent dressing. It's there's no border on it. Then you have something that I can see right through. Okay, and then you would have a dressing that has some petroleum jelly through it. Again, there's no absorption properties in this. They will be for very shallow wounds. Then you would have some type of dressings that have antimicrobials. So the first one we look at would be iodine-based dressings. So you'd have just like povidone iodine here. Okay, can be designed to stay on for a wound for up to 2 days. And then you might have some Kadaxamar dressings. So Kadaxamar iodine. Some of them comes in a little tube form as well. These can stay on to up to 3 days. These are for clinically infected or critically colonized wounds. Another type of antimicrobial would be honey. So some of them come in a tube form. Okay, put it directly on the wound bed. Again, for any clinically infected wounds or for also for very good for sloughy wounds as well. Then you might have some honey that's impregnated into a type of dressing. Again, these are put directly on the wound. There's a very low resistance that can be used for up to 3 months. Just they might cause some wound pain because they work in the process of osmosis. A third type of antimicrobial would be silver dressings. So again, we would have silvers. It usually comes in kind of a grey colour. Again, this is a dry silver. It's a hydrofiber and it can be directly put on the wound. Again, another type of silver dressing. No absorption though for exudate. So it's a low non-adherent silver dressing. Then you might have a silver dressing that's impregnated into a foam dressing. So it has an island here and then it has adhesive, or you might have a non-adhesive silver foam dressings. And then you might have a silver dressing that's non-adherent, again, very low capacity for absorption levels. Again, you would only use these for a short-term period. We do talk about the 21-day rule for any silver type antimicrobial dressings, 2 to 3 weeks, 14 to 21 days. Then you might have some foam dressings. So again, some foam dressings, you might have foam dressing non-bordered. Then you might have a foam dressing that's bordered. Okay, so by bordered I mean it has some adhesive. Again, with this one, some of them have adhesive, some of them don't. Some of them have are silicone based, which is nicer on the skin as well. Another type of dressing we will come across is hydrocolloids. So again, they've no capacity for absorbing up any exudate. It will be for very low exudating wounds, shallow. This comes in the same colour as skin, and then you can see through this one then as well. Okay. And then another type of dressing then for odour, we will come across dressings that have carbon in them. Again, this kills the odour. One of the things about using this is to make sure that once you put it on to a wound that the exudate hits it. And that's basically today when we talk about the types of wound dressings that we will come across in our clinical day. Thank you.